Concord Orthopaedics covers a number of high schools. Bishop Brady, Merrimack Valley, Concord High School, Pinkerton, Proctor Academy, Kearsarge, St. Paul's, a host of different schools, private and public in terms of that. We volunteer to do it. We enjoy working with young athletes. We have a fun time. It's nothing like a beautiful night and have high school football. It's a lot of fun. So we work closely with the trainers who obviously follow these athletes during the week and see them during the week. We don't have the luxury of X-ray or MRI or anything on the sidelines. It's all really a clinical decision making, and obviously we want to do what's safe and best for the athlete. But as the games go on and there are playoffs games, the players want to play. There's some, the coaches want them to play, but we want to do what's safe for them. And so we do our clinical exam as best we can. And if there's any doubt, we hold them out. But a lot of times, if you've done this for a few years, and unfortunately I'm getting older, so I've done it for more and more years, you get a sense of what's serious and what can needs to sit out and what can continue to play. And so, shoulder injuries we see a lot of, shoulder dislocations, shoulder subluxations, AC separations. Those are all clinical decision making. If a kid tears his ACL, he's done for the game for sure. There's more and more of emphasis on having athletic trainers at certainly schools and games because they can care for the athletes during practices. Concord Orthopaedics has been volunteering for, I would guess, 20 years doing this type of thing, covering football games, some hockey games, lacrosse games, contact sports a lot of times. And again, we cover a number of schools. There's a number of us who do it. And it's something we do because we're passionate about sports and we're passionate about safety for athletes. The athlete always pushes back because they want to play and they want to be in the game. And there's an element of trust that has to develop over time for the athlete to know that you're in their best interest, and if they have a hangnail, you're not going to hold them out for that. But they want to play, and so it's obviously you have to take the objective evidence, meaning are they weak, are they dizzy, are they have any symptoms of concussion, and then they're definitely out, or is it more they're a little bit sore, they have full range of motion, good strength, because every time the athlete's going to say we want to play.